I did my first rotation at Cornell in New York. Bad hand injury when I was like 14.
Okay.
And
So,
then
like for us, like med school students, I'm sure a lot of people watching are med students. How can we start preparing for that rotation?
this is where most of our students kind of struggle with.
Tomorrow I'm going to rotations.
Right.
What's some advice you would give me to kind of stand out?
So one of the reasons why I got into those rotations, I feel is because of my personal statements kind of start pretty early.
Okay.
It's like at 5 a.m.
Oh,
which
wow.
is- At the same time, there's like a fine line of balance where you should be interested, but don't seem desperate.
Okay.
Yeah.
Hey everyone, my name is Rohan Shah and I'm the host of The Memoirs. Today it's my honor to introduce you guys to Dr. Dinakar. Today we're going to talk about the USMLE, going a bit more into specific about rotations, how to succeed in rotations. Dr. Dinakar is a USMLE 2025 aspirant who'll be joining the match this year, and he's a surgery applicant. Why don't you introduce yourself, sir?
All right. Hey guys. First, let me appreciate Rohan for doing this. I always wanted to share information with everyone, but then he's providing me a good platform to do it. Interested in general surgery, and I'll be applying to the general surgery match this cycle.
So before we start, just a bit on qualification. So what was your step 2 score again?
My step 2 score was 255.
Yeah.
Yeah.
Exactly. I mean, and for you guys who don't know that, 250 is like an excellent score. Anything above that is like next level. 255 is like out of this world. Literally, it's an excellent score.
Thank you.
Where did you do your rotations?
So I did my first rotation at Cornell in New York, and then I did the other rotations at University of Florida in Jacksonville, and one at University of Alabama at Birmingham.
Mhm.
And I did my last rotation at Mayo Clinic.
Okay.
Yeah.
Yeah. And then again, those of you guys who don't know who are not native to the US, again, those are literally some of the top hospitals and universities in the US. Very difficult to get those. Very, very qualified individual we have to share some knowledge for us. Okay, well, let's jump right into it. So, at the very beginning, before starting this process, why did you choose USMLE?
So when I was doing my internship, it kind of hit me, like we are doing something, but where are we getting this information from? So then I started looking back at all the trials and how we are where we are. And that kind of like drew me towards the US, because that is where like there's a lot of research going on, and they're successful in integrating the results of the clinical research with the actual clinical practice, and are able to come up with protocols and stuff which is acting like literally as a guideline for the rest of the world.
Yeah.
So that is what kind of drew me to the US.
Okay. So, like, apart from that, now that you've decided USMLE,
Mhm.
for me, and I'm sure for a lot of you guys, as soon as we hear USMLE, it's internal medicine. Like, it's
Right.
unheard of to do surgery. So what kind of inspired you to do surgery, and like, what do you have to do differently? Can you talk about that a bit?
So yeah, I think the decision to do surgery came as a result of my personal experiences as well as my medical training, especially during internship. So I had a bad hand injury when I was like 14,
Okay.
and then I was operated on by a plastic surgeon like later that night, and he was actually able to save my hand.
Okay.
And so that was where I was kind of fascinated by how advanced the techniques have become, because like back in the day, once your nerve is injured, it's like that's it.
Gone, yeah.
Yeah, you just call it a day. But now I'm able to do like all my functions like as good as before.
Yeah.
So that kind of made me interested in surgery and the impact that we can create in people's lives.
Mhm. Yeah.
And that, and even during internship, I really had a good time, like in the department where, like they let me do debridement for people with necrotizing fasciitis and stuff like that. So I had a really nice time, and I created this good rapport with the patients. And they used to, like when they used to see me in their after their discharge, like when they come back to the OPD,
Yeah.
and they used to recognize me, and they used to talk to me, and they used to like thank me.
Yeah.
And that was kind of like surprising to me because I've never experienced that
Yeah.
before. So that's what kind of drew me to surgery. It's like personal,
Yeah.
and I think that's what keep me going.
Yeah, of course. I get it. So, I mean, obviously that's a really daring decision, dare I say, because not many people from India go to the US in surgery.
Right.
So, kind of what do you think you had to do different throughout that process as opposed to all the internal medicine applicants?
Right. So one thing that I'd say is I had to show how passionate I was for surgery.
Okay.
So rotations are one way of showing them that, because they get to see how I'm performing in the American healthcare system.
Yeah.
And you can also do research. I think that's it. Yeah.
Okay. So, and then apart from that, so do we have to build our CV specifically towards surgery? Or is
So if you're not interested in surgery from the beginning,
Yeah.
but you're kind of wanting to explore like how the specialty is gonna be,
Yeah.
and then you maybe can do like a mix of rotations. Like one in internal medicine, one in surgery,
Okay.
and one in any other specialty
Yeah.
that you like, and then you can actually decide for yourself
Mm-hmm.
what you like the best,
Okay.
and then you can actually tailor your application towards that.
Okay. So like our research projects, all of that, we should
Exactly.
go towards
Yeah.
surgery after we decide.
And it's a known fact that as an undergrad student,
Mhm.
you don't really get to choose
Yeah.
what kind of research that you do.
Mhm.
So any research is fine as long as you're interested in the project
Okay.
and it kind of aligns with your values.
Mhm. Okay. Totally. I get that. So now you kind of mentioned rotations.
Mhm.
So going a bit more specifically on rotations. So you said we can do rotations in multiple different specialties.
Yeah, we can.
But once we kind of, let's say we narrow in on surgery in your case,
Right.
how do you approach that process, getting the rotations?
So again, especially for international students, I kind of compare applying to rotations with the actual residency application, because you have to send them your CV, you have to send them your personal statement, you have to send them, like a letter of interest
Mhm.
or intent, like
Yeah.
why that specific rotation in that specific program. So again, this is where most of our students kind of struggle with,
Mhm.
is the personal statement.
Yeah.
Because we're not used to that in our system.
Yeah.
And it's really difficult when you actually do it for the first time.
Of course.
And so honestly, one of the reasons why I got into those rotations, I feel, is because of my personal statement, because I wrote, like how personal surgery is to me, and, like all the things that I did back in internship,
Yeah.
and why I actually want to be in that program.
Mhm.
Because it's like we don't really get to do a lot of minimally invasive procedures here, and in the US you get to see a lot of minimally invasive procedures. So that is something you have to let the program know, that why you want to be there.
Okay.
Exactly.
Okay, I totally understand that. So now that we've kind of gone through like the personal statement and all that, so it's how important is it to like, we have to come up with a story, but like it has to be a real one. Do you get what I'm saying?
Exactly. Yeah.
A lot of people, like I've heard, for example, they'll pay for rotations.
Right.
They'll pay for research papers just to build their CV and for these things. So what do you think about like those things? Will it actually help us, or?
I think it depends on which specialty you're applying to, because a lot of the people who do that usually end up applying to IM.
Okay.
And so back in the day when not a lot of people are applying, it used to be easy for people to get into programs just based on their scores. But now, like, it's incredibly competitive, even for IM.
Yeah.
So even for IM, you need to have like stellar scores. You need to have like good rotations, and as a person, like they are seeing holistic development in a person.
So when applying for these rotations, do we have to have step 1, step 2, and then all of these, or like can we do it with just step 1? What do you think?
So it's competition. So basically they'll see your CV. So one of the things they look at before giving you a rotation is your command on English language.
Okay.
So I would say it's better if you actually take TOEFL, which kind of shows them how good you are with English. And then like step 1 is obviously a good thing to do, because it kind of shows how clinically good you are, because that's an assessment that they can trust, right? Yeah. So having a step 1 is definitely a good thing, but there are universities who offer rotations even without step score, like, or a step pass or fail, because there are people from other countries who come to the US just to do the rotation, just to
Okay.
experience that.
Oh wow.
Yeah, without having the intention of USMLE.
Yeah, understood.
So there are certain universities who like that do that,
Mm-hmm.
but yeah, I think it's definitely better to have a STEM score.
Okay. And so once we've done like our rotations or all this stuff, like once we gotten in, how do we stand out in those rotations? Like what should we do? Like what do you suggest? First of all, can you kind of run us through the concept of it? What do we do in rotations?
Right. So in rotation, mostly you will be acting at the level of an MS4, which is like the final year med school for the US
Okay.
students. And so it's technically called like a sub internship,
Mm-hmm.
especially if you do these rotations at a university.
Okay.
So you basically get to take part in active patient care. So it's like you get to treat round patients, you get to present those patients during morning rounds, and you can actually write their progress notes on a daily
Mhm.
basis. You can be involved in the team discussions. And if you're doing a surgical rotation, you get to be in the OR, you get to assist in the procedures, you get to scrub in. And and if you're good, I mean, if you're showing interest and if they're like impressed,
Mhm.
they do actually give you like stuff to do, like
Okay.
sewing and even like maybe giving an incision.
Mm-hmm.
Yeah,
Okay.
all that stuff. Yeah.
So you mentioned like kind of standing out, impressing them. So how do we like? What would you suggest? Like, let's say tomorrow I'm going to rotations.
Right.
What's some advice you would give me to kind of stand out?
So I think you gotta have like the basic discipline.
Mm-hmm.
So show up on time because the rounds kind of start pretty early.
Okay.
It's like at 5 a.m.
Oh
which
wow.
is especially if you're doing like a surgical rotation,
Okay.
and especially in some services like acute care surgery.
Mm-hmm.
So it's really different from what we have here,
Okay.
where usually the rounds kind of start at like 8 a.m.
Yeah. Yeah.
So that's one thing I'd suggest. Like, be on time, be attentive, show that you're interested. And at the same time, there's like a fine line of balance where you should be interested, but don't seem desperate.
Okay.
Yeah. So it's like, don't strive for your professor's attention.
Mm.
It'll obviously come in as you care for the patient,
Yeah.
because patient care is what they value the most.
Mhm.
And you just have to do the job and everything else will follow.
Okay. So, like for us, like med school students, I'm sure a lot of people watching are med students. How can we start preparing for that rotations now? Like, what could we do now that would help us for that?
So, what I can suggest is when you're doing a rotation here, like you're doing your postings,
Yeah.
you can actually take the initiative to take a case like all on your own,
Okay.
like taking the history, the physical, and even the examination,
Mm-hmm.
and actually practice presenting that in the SOAP format, which
Okay.
is subjective, objective, assessment, and plan,
Okay.
which is the system that's frequently used in the US healthcare system.
Mhm.
And I honestly feel it's an efficient way of presenting the cases because it kind of saves time, yet it includes all the details.
Okay.
Yeah.
Okay. Understood. So main thing is just kind of we should take initiative here and
Exactly.
get that experience.
Like, take initiative, go take history, examine the patient, and try presenting that to your attendings or someone here so that you won't struggle with presentations there. Because I understand for a lot of students who are from here, presenting in English
Mhm.
at that pace
Yeah.
can be difficult,
Of course.
especially in the beginning.
Mhm.
There's like a steep learning curve. So that's what I'd suggest. Like, practice your presentations, and if you're doing a surgical rotation, practice the basic surgical skills like sewing, like hand nodding and
Yeah.
stuff like that. And they really appreciate that.
Okay, okay. And I mean, I know a lot of us, like for me, for example, the first time I heard about this, I was really kind of scared rotation because it seems like kind of an exam. They're testing you there.
Exactly. It kind of feels like a 1 month long job interview.
Mhm, yeah, okay. So, I mean, would you say that like what suggestion would you give for people who are scared going there? Would you tell them to just kind of relax or you should be a bit tense?
I think you should be a bit tense
Mm.
because, like, once you're relaxed,
Yeah,
you kind of do all the wrong things.
of course.
I think it's good to have, like, a moderate, like a decent amount
Mhm.
of anxiety, because that's what kind of keeps you in the right track.
Of course.
At the same time, you don't have to be like too anxious because the people, the attendings, the residents, they're usually supportive and they usually help you out. They'll teach you. It's not like you you should be like a know-it-all kind of guy, but you should be willing to learn.
Oh,
You should basically go with an open mind. You should do your homework. You should read upon the cases. You should be on top of everything. Like, you should know your cases.
yeah.
So we should do that, but it's not like you have to be a know-it-all kind of guy.
Okay.
Yeah.
Nice. So, and now this rotations, when would you say is like the best time, or when should we target to get these rotations?
Right. That's actually a very good question, because so how these rotations work out is, so for the US students, their academic year usually starts in June. So all the rotations from June, and even I think all the fall rotations are usually filled by the US students, because they also do away rotations at these prestigious institutes. So a good time for us to target these rotations is between January and June.
Okay.
Yeah. And so usually these applications, they are different, like different universities do it in different ways. So for some, they start their application for the whole year in I guess April.
Okay.
So you should like pick a date,
Mhm.
and then you should apply in April. And I feel you should leave a decent amount of time between the time you apply and actually the time you want to go, because there's like a lot of competition, and they have to go through your whole application package, and which takes a lot of time.
Yeah.
So I think you should allow at least like 6 months between when you are applying and when you want to go.
Okay.
Yeah.
Okay. Totally. And now, kind of backtracking a little bit into the steps. When do you think? And I mean, this is a site where like a lot of people get confused.
Right.
Step 1, step 2. When should we write those?
Right. So yeah, I think now that since your third year of med
Third year,
school
exactly.
has only forensic medicine and SPN,
Correct.
I think that would be a perfect time to take your step one, because you'll still be fresh with your preclinical memory.
Mhm.
And at the same time, it kind of leaves you a good time to kind of touch upon all that topics and like relearn the whole thing.
Yeah.
And actually take the step. It's a kind of like a breather period in your med school. So I think that would be a perfect window to take this.
Okay, understood.
Yeah.
And now, how long do you think it takes to study for step 1 for someone who hasn't started at all? Let's say.
Right. So I think an average student usually takes like 6 to 8 months.
Mhm.
It's not like 100% dedicated. It's like, so 4 to 5 months of it will usually be, you'll be going to your regular classes and be preparing like in your free time.
Mhm.
But I think you should need at least like a month or two of dedicated prep period.
Yeah.
Where you only prepare for the step.
Okay.
Yeah. Well, maybe I think a month should be enough so that it's past fatal.
Mm-hmm. And now for step 2, like when should we take that? Like right after, or like should we wait for some time?
So that's actually, I think it's a controversial topic.
Yeah.
Because your step scores, they kind of get like outdated.
Okay.
So the sooner you take it is the longer the duration between the time you took it and actually the time you apply. So they'll be like kind of outdated by that time. So I suggest take your step 2 probably somewhere close to application cycle. Maybe like you can take a break in your internship, and maybe you can prepare for the step at that time, or do your rotations, be done with your internship, and then take the step.
Okay. And then for like kind of backtrack back to rotation, should we try and target those during our internship period, or should we wait till we finish it to do rotations? Or
I think doing it during internship would be an ideal thing.
Okay.
Because you still have to be a student.
Okay.
Yeah. To do a rotation, you still have to be a student. Once you graduate, you're not allowed to touch a patient in the US.
Okay. So once we graduate, it's like fully hands off.
Exactly.
That doesn't matter.
Once you graduate, it's only residency.
Okay.
Yeah.
Understood.
I mean, it does matter, because so when people are writing you a letter of recommendation, they can't really assess you to like 100% when you're only observing.
Okay.
Exactly. And when you're not taking part in like active patient care.
Okay.
And this is especially true for surgical specialties, because they need to see your behavior, your like enthusiasm, your commitment in the ORs and the floors, and they can. I don't think they can do that if you're only observing. Okay.
Hold on, don't go away just yet. Take a look at part 2, which is out right now, where we go into the details on how you can get research as a med student.